So skin cancer, most tumors that we find in people's bodies are benign. So most tumors are benign. It's not anything we have to worry about. It is just a grouping of cells that have grown. They don't metastasize. And that's what benign means. Benign means not cancerous. And they don't metastasize, which means they don't spread. So what causes skin cancer? The majority of the skin cancers that we have, so if it is cancerous, if it is malignant, if it does metastasize, if it does spread, it's typically caused by UV radiation. We know that all forms of radiation damage living tissues, right? And so how do UV rays cause cancer? What's happening here? So we know that the DNA that's in your cells, that's in the nucleus, is the instruction manual. It tells your cells everything they need to know about themselves, including how often to divide, right? Cancer is just uncontrolled cell division. It's when the cells are dividing too fast and you get a big mass, a big ball of cells. That's a tumor, and that can be cancerous. And so when your cells divide too rapidly, that's not a good thing. And so one thing that UV rays can do is, remember, UV rays can get into the DNA and they can cause your DNA to mutate. They can rewrite the instruction manual. And so now your cells can replicate too often, can divide too often. So it can damage the DNA. It can rewrite the instruction manual. The other thing that UV rays can do is they can target, or they do typically target, a very particular gene. And this is a gene called the p53 gene. We have dubbed this one the tumor suppressing gene. So bear with me as I talk about this one. So normally this is a gene that's in every one of your cells. And the job of this gene is literally to slow down cell division. So think of it as sort of like pushing down the cells saying, don't divide too fast. That's the job of this gene. So it's always suppressing cell division. When UV rays damage this gene, they turn it off. And if the gene gets turned off, well, now you don't have anything telling the cell to slow down. Don't divide too fast. Now the cell can do what it wants, and it can divide very quickly. And again, all cancer is uncontrolled cell division. The cells divide too fast. Okay? So both of these things caused by UV rays can lead to uncontrolled cell division. The second one that's listed up here, this p53 gene, is just a little more specific. Now, one thing that we do know is that when you are outside, if you have been in the sun, you did not have on sunscreen, we know that skin cells, when they are damaged by UV rays, your skin cells are pretty amazing. They'll produce a protein called the FAST protein. This is a protein that's going to cause all those cells that have been damaged to commit suicide. So typically it's the cells at the very surface. They're all going to commit suicide, they're going to die, and it's going to reduce the risk of sun-linked skin cancer. Because instead of those cells surviving and mutating too fast, instead they've all died. So this is why a lot of times if you are out in the sun and you get burned really bad, you will peel, right? You'll peel in sheets. That ever happened to you? When your skin just kind of comes off like in big flaky layers? What's happened is those cells have released the FAST protein and they've all died. They've committed suicide because they're trying to protect the underlying tissues. Okay? So there's actually 3 different kinds of skin cancer that I'm going to walk you through. These are kind of the most common forms that we see. So the first one is called basal cell carcinoma. This is the most common. This is also the least malignant, meaning that it doesn't typically spread. Sorry, it's the least, not malignant, the least to metastasize. Doesn't typically spread to other places. We also have squamous cell carcinoma and melanoma. So those are 3 forms of skin cancer. And I have them listed up here from most common to least common. Okay, they're also listed from doesn't metastasize very quickly to metastasizes very quickly. Okay, so let's go through each of these. So we'll start with our basal cell carcinoma. Again, this is one that does not metastasize very quickly, so it doesn't spread very fast. And it is the most common form of skin cancer that we have. This one is actually, the reason we call it basal cell is, hang on. Woo. Sorry, my board's doing something super crazy. I was just listening to a podcast about ghosts. I feel like there's a ghost in here. All right. So the reason we call this one basal cell carcinoma is because it arises from that bottom layer, stratum basale. So what's happening is cells in the stratum basale are dividing uncontrollably. And what's happening is those cells are dividing uncontrollably, and they're actually pushing downward, down into the dermis. So they're invading the dermis and the hypodermis. Now this one, like I said, it's slow growing. It does not metastasize very easily. And this one can actually be cured most of the time, 99% of the time, by just doing this sort of wide surgical excision. And this would just be where they sort of cut out the cancer. So they would just sort of cut out this whole region, do a big wide excision, and then stitch it back together. Now, another way that they'll typically do basal cell carcinoma is they can do a type of surgery called Mohs surgery. And it's where they go in, it almost looks like a melon scooper, and they kind of scoop it out and then immediately run pathology on it while you're still there, while you're still in the office. They make sure they got clean borders. What that means is there's no cancer on the edge of what they cut. If there's still cancer around the edge, that means they may have left cancer up here, in which case they will cut out some more. So they'll go deeper and deeper until they get clean borders. Okay? But 99% of the time, they can cure this using that wide surgical excision. Okay. Squamous cell carcinoma. Squamous cell carcinoma is a type of cancer that comes from the keratinocytes. So remember, keratinocytes produce keratin. These are the ones that are found in that epidermis, typically coming from the stratum spinosum. These arise most often in places where you get the most UV rays. So your scalp, tops of your ears, your nose, your bottom lip. These are all places where you get a lot of UV, direct UV rays, also places that a lot of times you forget to put sunscreen on. This one, it grows faster than basal cell, and it will metastasize if it is not removed. And the prognosis is good if you remove it surgically and then a lot of times treat it using radiation. And then the last form of skin cancer, whoops. Y'all, I'm struggling with this camera. The last form of skin cancer is called melanoma. Melanoma is cancer of the melanocytes. That's why it gets it, how it gets its name. This is the most dangerous form of skin cancer because it metastasizes very quickly. So it spreads really quickly. And it is resistant to chemotherapy. So normally how we treat any kind of cancer that has spread is if it's spread throughout the entire body, we're going to give you a treatment that's going to kill off rapidly dividing cells. And that's what chemotherapy does. Chemotherapy is a whole body treatment and it kills off any cell that divides rapidly. Well, now you got to think about it. You actually have cells in your body that naturally divide rapidly, right? Like skin cells. Your skin cells divide rapidly. The lining of your intestines and your stomach, they divide rapidly. You're replacing the lining of your stomach about every 2 to 3 days. So this is why when people have chemotherapy, this is why their skin gets so dry. This is why a lot of times they get nauseous and they throw up. It's because this is a treatment that's killing off all the bad things that are dividing rapidly, but it doesn't know the difference between the bad things and the good things. Naturally, epithelium divides rapidly, right? So it is going to target things like linings and coverings of your body. Unfortunately, this is pretty much the only treatment we have right now for cancer, that it has spread and metastasized. And unfortunately, this doesn't work for melanoma. So if somebody has melanoma that has spread and metastasized, usually they're going to have to do a wide surgical excision. So they're going to have to cut it out from this original area. So they'll excise it and cut it out. But if it's already spread, usually they might do some immunotherapy. That might work, but there's not a whole body treatment that works on melanoma. So this one is incredibly dangerous. So this is why it's really important that if you are out in the sun, if you, like I was a lifeguard when I was younger, I was always a swimmer, I taught swim lessons, I was always outside, and I grew up in the 80s and 90s, we didn't wear sunscreen. That just wasn't a thing. My parents have always had a boat, so we're always on the lake, and I would just get fried on my face. And I pay the price for it now. You know, I go to the dermatologist 3 times a year because they've removed things from me that indicate that I am more at risk for melanoma than somebody else. So I'm going for mole checks 3 times a year. It's quick, it's painless. All I do is just kind of scan you and look for anything abnormal. You know, if you are in your 20s or older, I would say that you definitely need to be going for mole checks. Some of these things are really deadly. Let me see if I can erase this. Hang on, give me just a second. It's going to drive me bonkers. Nope. Okay. Well, we're just going to have those black lines on there. Can't get rid of them. One of the things that a doctor will do if they're doing a check on you or something you can do on yourself is you can do a screen. And so what they're looking for when I go into the doctor, when I go to my dermatologist, she looks for anything that looks abnormal, and they follow what's called the ABCD rule. A stands for asymmetry. So if the 2 sides of the pigmented area don't match. So maybe you have a mole that on one side it's nice and round, and on the other side it looks more like that. That is a red flag. Border. The border is irregular. So if instead of being nice and round, it does this, right? It should look like this. So if you have a mole or a freckle that is a little irregular, that would be the border. Color. If it is black, brown, tan, mottled, so a mixture of all of those, or has any red or blue in it, you need to have it checked. And D stands for diameter. If it's larger than about 6 millimeters, which truly is only the size of a pencil eraser, you need to have it checked, okay? Now, the last thing I'm going to walk you through in this chapter is just a little bit on burns. So first degree, second degree, and third degree burns. These are actually named for the layer of skin that has been damaged. So a first degree burn damages only the first layer, the epidermis. And what you're going to see in a first degree burn is the epidermis has gotten damaged, your skin is very red, and it might be sore. It might hurt to touch it. So an example of a first degree burn would be like a sunburn. A second degree burn damages 2 layers of your skin. It damages the epidermis and upper regions of the dermis. So what you're going to find in terms of symptoms of a second degree burn is you'll have redness. It'll be painful, but it's usually also accompanied by a blister. So remember, I told you earlier in this chapter, what causes blisters is when the epidermis and dermis pull apart from each other. You get a fluid-filled pocket in there. And that can be from friction. It can also be from a second degree burn, right? You damage those 2 layers, they pulled apart, and now you get fluid. So examples of a second degree burn would be like an oven burn, right? You're pulling cookies out of the oven and you accidentally hit the side of the oven with your hand. You might get a blister in that area. Curling iron burns, right? Or flat iron burns, get them on your neck. Sometimes those would be second degree if you get a blister. And then a third degree burn, this is where you damaged all 3 layers of your skin. Now, a lot of times with a third degree burn, it'll look different. It just depends on the person. Sometimes it is bright red. Sometimes it's sort of charred looking, black. Sometimes it's white in color. But initially, there is no swelling or pain. There is no pain because you have damaged every nerve ending that's in your skin, so you don't feel anything. Now, as your body tries to heal and as those nerves try to regenerate, you're going to feel it, and it's going to be very painful. A lot of times, skin grafting is necessary if the area is big enough, meaning they'll have to take skin from somewhere else on your body to sort of help heal that area that's been damaged. The biggest issue with a third degree burn is typically fluid loss. Think about your skin. Your skin is a waterproof coating. It's your body raincoat, right? It keeps the inside in and the outside out. So if you've burned through all 3 layers of your skin, you don't have that waterproof coating anymore. So fluid loss is a huge problem for people with third degree burns. So this is actually an image. This is from a former student of mine. She gave me these pictures, told me it was fine to include them in lectures. So this woman was a manager at a fast food restaurant, and she was closing the restaurant down for the evening, and another worker with her, they were cleaning, and she was up on a ladder doing something, and the other worker was cleaning the fryer vats and had taken the fryer vat out and set it on the floor. Well, this girl did not know that the fryer vat was right behind her. And as she came down off the ladder, she put her foot into that burning oil. And so you can see in the image, you can see that her skin is cherry red. Now you can see the bottom of her foot. So remember, this is all thick skin on the bottom of her foot. So that skin actually did sort of okay. They had to do a skin graft. They took skin from her thigh. You can see where they grafted it right here on her. And so this is 5 weeks after her skin graft and a wound vac for healing over here on the left. So you can see that, you know, it takes a long time to heal from this. And then you can see on the right, that's 8 weeks after surgery. And so that burn of hers would have been classified as a critical burn. And the reason is we use something called the rule of nines. The rule of nines is how we estimate whether a burn is critical or not, how severe it is. What we do is we divide the body into 11 areas. Each one is 9%. That's why it's the rule of nines, right? 11 times 9% is 99%. The other 1% is coming from the perineal region. So this is that anogenital area. A burn is critical if over 25% of the body has a second-degree burn, if over 10% of the body has a third-degree burn, or if there are third-degree burns on the face, the hands, or the feet. So you can see her burn was classified as a critical burn since it was on her feet. So this is showing you the rule of nines, right? So you can see the body and how it's been divided up. You can see this is just an anterior view. So you've got the front of the head, right, is 4.5%, and the back is 4.5%. So your entire head is 9%. Your arms, again, the front is 4.5, the back is 4.5. So one arm is 9%, the other whole arm is 9%. Now the legs are going to count for more, right? So the front of each leg is 9%, basically 4.5% for the thigh, 4.5% for down in the tibial region. So the full front of the leg is 9%, full back of the leg is 9%. Anterior trunk is 18%, and the back is 18%. Okay, so all of that will add up to 100%. All right, so the very last part of this chapter is just on tissue repair. So if you damage your skin, you get a cut, how does your body go about repairing that? Well, you can heal your damage one of two ways. One is through a process called regeneration. This is where you replace what's been damaged with the exact same tissue. So later on, you never even know it was damaged. So it would be like, you know, you get a scratch, maybe your cat scratches you. Your body will replace that with the same tissue, and you're not going to be left with a scar or anything. You wouldn't even know. You wouldn't know, you know, 2 weeks from now that you had anything wrong. The other process is through fibrosis. This is when the damage is pretty severe and your body can't replace it. It's too much. You can't replace it with the same tissue. Instead, you replace it with scar tissue. Which type depends on the severity of the tissue damage, right? If it's really severe tissue damage, you're going to replace it with scar tissue. So the steps that we have for fixing damage, a cut in your skin, for example, would be inflammation, organization, and regeneration. So let's go through each of these steps and talk about what they mean. So inflammation. So you can see over here the skin, you've gotten a cut in your skin. First thing that's going to happen is the whole area is going to get inflamed. This is actually part of the immune response. So this is a normal phenomenon. What happens during inflammation is your blood vessels dilate in that area. They get big and they pump blood to the area. So it gets red, it gets hot, it gets swollen. And you're not only pumping blood to the area and fluid to the area, but you're pumping white blood cells to the area. And they're getting there so they can fight the infection. Okay? So you're releasing a lot of chemicals in this area so that you can call for increase in blood flow, that you can get these white blood cells in the area. Okay? You also have some clotting factors that come to the area. Clotting factors help your blood clot. And so these clotting factors are going to help to stop blood loss. And that's really important, right? You get a cut in your skin, you're going to bleed, but you don't want to bleed for too long. Bleeding is important because it actually helps to flush the wound out. But if you don't stop bleeding, that's not a good thing, right? You would lose too much fluid. So eventually you want clotting factors to stop the blood loss. And those clotting factors are also going to help you create a scab. Scab is your body's temporary Band-Aid so that you can quickly seal over that wound and make that skin, that barrier, continuous again until it heals. It also prevents those microbes from coming in. The second step is called organization. And again, this is where you start to replace the blood clot with granulation tissue. Granulation tissue is sort of like a scab. Now we know that granulation tissue has a lot of capillaries in it. You know this. If you get a scab, if you have a scab, my son does this all the time. His knees are covered in scabs. And he'll sit on the couch and pick at his scabs. And then guess what? They bleed all over my couch. So we know that scabs and granulation tissue, they have a lot of capillaries. And the capillaries are bringing the blood flow. They're bringing white blood cells to help fight infections. They're also bringing fibroblasts. That should sound familiar. Remember, fibroblasts are the type of cell that makes connective tissue proper. And so fibroblasts, since they make connective tissue proper, like areolar tissue, this is what we have in the papillary layer of our dermis. Dense irregular tissue is what we have down in that reticular layer. Since these fibroblasts help to make that tissue, they're going to help to rebuild the tissue. They're also going to help make collagen fibers. Remember, collagen fibers are stronger than steel. So these fibers are going to span the wound, right? So, can you raise that? Nope. They're going to span the wound, and they're going to help to pull it together like a zipper. Okay? Also, granulation tissue has bactericides in it. Remember, we talked about how your skin releases bactericidal substances. Granulation tissue does the same thing. And then the very last step is regeneration. Regeneration means that you're going to regenerate that surface epithelium underneath that scab. You may see a scar if you had to go through fibrosis, if you had to replace that with some kind of scar tissue. Okay, so it might be visible or invisible. A scar might be visible or invisible. It just depends on the severity of the wound. How bad was it? Okay, can we see a scar or not? Can you see that scar tissue or not? Last couple things in this chapter are just on the development of your skin. So from adolescence into adulthood, remember when you hit, usually there's not a lot of issues with your skin until you hit puberty. Once you hit puberty, you start releasing sex hormones, and your skin, your hair, they get oilier. So acne can be a problem. Your skin will start to show the effects of environmental assaults around the time you hit 30. So at 30, if you've been out in the sun with no sunscreen, you're going to start to have pigmentation in your skin. You'll start to see wrinkles. Scaling and dermatitis are more common as you age as well. So this is typically common as you get much older. Your skin will get really dry, right? So into old age, a lot of times epidermal replacement of your cells slows way down. So your skin actually starts to get thinner as you age. Have you ever noticed, if you have a grandparent, you ever notice how like you might see bruises all over them? And you'll be like, Nana, what happened to your arm? And she'll say, I don't know, because she really doesn't. Like she could have just bumped into something and you'll see a bruise because her skin is so thin. Epidermal replacement slows way down. The skin gets much more dry, so it's itchy. So I know my mom's always putting on cream. Subcutaneous fat, so that's the fat in your hypodermis, will start to diminish. And so a lot of times you're cold all the time as you get older. I know my husband's grandpa, he lived to be like 98. And we go to the beach with my husband's family every year. And when he was still going to the beach, we'd be out on the beach, Myrtle Beach in July. So it's like 108 degrees. And Grandpa Adams would be out on the balcony with pants and a shirt and a sweater vest and an Afghan over him because he's freezing. So that's really common. You also lose elasticity in your skin. so it doesn't bounce back as well, so wrinkles are more common. And then also you stop producing a lot of melanocytes. Remember, melanocytes make melanin. Melanin protects against UV rays. If you have less melanocytes, you have less melanin. So as you age, you are less protected from UV rays. So it is really important to make sure you're using sunscreen.